Hello everyone, welcome to our presentation. I'm excited to kick things off with episode 18. Today, we'll explore some fascinating insights and key topics. We'll cover the main themes and give you a clear overview of what to expect. So let's get started and dive into this next chapter together. Now, let's look at a scenario where Nurse Perry is evaluating a male client's renal function. After documenting urine volume and characteristics, she needs to determine which signs are most indicative of how well the kidneys are working. The options she considers include blood pressure, consciousness, distension of the bladder, and pulse rate. Of these, the most reliable indicator of renal function is actually blood pressure. Why is that? Because the kidneys play a key role in regulating blood pressure through fluid balance and the renin-angiotensin system. A significant change in blood pressure can signal impaired kidney function. While consciousness, bladder distension, and pulse rate can provide useful clues, they are less directly related to renal performance. So, understanding which signs truly reflect kidney health allows us to assess and monitor renal function more effectively. Let's talk about blood pressure, which is a crucial indicator of our overall health. Blood pressure measures the force of blood pushing against the walls of our arteries as the heart pumps blood throughout the body. It's typically expressed with two numbers, systolic over diastolic. The systolic pressure, the top number, reflects the pressure when the heart contracts and pumps blood out. The diastolic, the bottom number, indicates the pressure when the heart is at rest between beats. Maintaining a healthy blood pressure is vital because high blood pressure, or hypertension, can increase the risk of heart disease and stroke. Conversely, low blood pressure might cause dizziness or fainting. Monitoring and managing blood pressure helps us prevent serious health issues and maintain overall well-being. After evaluating urine volume and its characteristics, we find that blood pressure is actually one of the most reliable additional indicators of renal function. The kidneys are crucial in controlling blood pressure, and they do this through several key mechanisms. First, they help regulate fluid balance, which directly impacts blood volume and pressure. Second, they manage sodium levels, which influence fluid retention and overall vascular tone. Third, they activate the renin, angiotensin, aldosterone system, a hormonal pathway that plays a vital role in maintaining blood pressure stability. When renal function is impaired, it often results in fluid retention and hormonal imbalances, which can lead to hypertension. So, in essence, the kidneys do more than just filter blood. They are actively involved in keeping our blood pressure in check, and any dysfunction can have significant consequences for cardiovascular health. Let's talk about consciousness first. It's important to remember that changes in consciousness tend to be late and nonspecific signs. That means they often appear only after significant problems have already developed, so they aren't the most reliable early indicators of renal issues. Moving on to bladder distension, this usually indicates urinary retention, not necessarily kidney function itself. A distended bladder can tell us there's an obstruction or retention somewhere along the urinary tract, but it doesn't directly reflect how well the kidneys are working. As for pulse rate, it's not a direct indicator of renal status either. While changes in pulse can sometimes be associated with overall health or dehydration, they don't provide specific information about kidney function. So why not rely solely on these signs? Because they tend to appear late or are nonspecific, which means they aren't the best early warning signs for renal problems. This emphasizes the importance of looking for more direct and timely indicators when assessing renal health. Now, when it comes to assessing renal function, the most reliable indicators are urine output and blood pressure. These two parameters give us a good sense of how well the kidneys are working and how the patient's overall volume status is maintained. Urine output is straightforward. If a patient is producing enough urine, it usually means their kidneys are functioning properly. Conversely, a significant decrease can be an early warning sign of kidney impairment or fluid imbalance. Blood pressure also plays a crucial role because it reflects perfusion to the kidneys. Low blood pressure can compromise kidney function, leading to potential injury, while stable or appropriately managed blood pressure suggests better renal health. So, as a key exam tip, always remember to monitor urine output and blood pressure carefully. They're your best clues in evaluating renal function efficiently and accurately. These indicators connect to the overall theme of understanding organ function and maintaining patient stability.